So this is a little addendum to my last video because I wanted to clarify what I meant when I say that there are good and bad professionals in every occupation, particularly in chiropractic. Just for context purposes, I was talking about how I practice evidence-based chiropractic. So the reason why there is so much confusion with our profession is because we lack unity. There are chiropractors that practice like myself. There are chiropractors that consider themselves philosophy-based, and then there's what's called mixed, which is somewhere in between. Then, of course, a lot of chiropractors might have specialties. So they might do a lot of nutrition in their office. Maybe they do kinesiology or muscle testing, so on and so forth. My point is, it doesn't matter what category a chiropractor puts themselves in, whether that's philosophy or evidence-based, does not make them good or bad. Just to be clear, a chiropractor that might practice evidence-based chiropractic doesn't make them any better or more superior than someone who is strictly philosophy-based. I believe that if it makes you feel better and it's working for you, then you should do it, regardless if there's not enough scientific research yet. I find it extremely arrogant when people are constantly, there's not enough proof, there's not enough scientific evidence, but we haven't figured it all out yet. We don't know everything. So to circle back, when I said that there are bad chiropractors out there, what I meant is that there are chiropractors that make false claims or false promises. Yes, I believe in holistic wellness, and I believe that the body has the ability to heal itself. However, if your chiropractor is telling you that an adjustment is going to heal everything in your life, including cancer, then that is a false promise. If you're not feeling any better with treatment and they're not providing you any insight or other recommendations, or most importantly, hindering you from seeking out other treatment, then this is also not a good sign. This is a sign of a good chiropractor, by the way. If you're not seeing significant improvement in a reasonable amount of time, then often I will make suggestions of other options that they can try. I don't see them improving. I will say, you know what, maybe you need to see a physiatrist for pain management, or perhaps you need a little bit more PT involved. Unfortunately, I've been on the blunt end of some bad medical doctor advice. I've often had patients that have seen an orthopedist or a physiatrist or some kind of medical professional for something else, told them that they were seeing me for their care, and their doctor, straight up told them to stop seeing a chiropractor because we're all bad. So in my opinion, a good healthcare professional of any sort, physical therapist, medical doctor, chiropractor, is going to check their ego out the door. So no, I'm better than you, and you're going to do what's right for your patient. It's all about the patient. It's not about us.